Hello everybody, my name is JC Redmond and today I'm going to be going over PCV13 versus PPSV23, the two different pneumococcal vaccines that are on the US market. Just to start off, first this is a disclaimer. The views of this presentation are my own and reflect the data from the references listed at the end of this slide set. All right, so a little bit of background on these vaccines. These vaccines help prevent pneumococcal disease, which is basically any type of illness caused by Streptococcus pneumoniae bacteria. And it causes serious infections in the lungs, lining of the brain, and spinal cord and blood. Pneumococcal disease is common in young children. However, in older adults, there is the greatest risk of serious illness and death. So what is the difference? There's two different vaccines on the market, like I had previously mentioned. A 23-valent pneumococcal polysaccharide vaccine, or the PPSV23, contains antigens from 23 common serotypes. And then there's a 13-valent pneumococcal conjugate vaccine, or PCV13, which contains antigens from 13 different serotypes. And there's actually substantial overlap in the antigens contained within each vaccine. 12 of the 13 serotypes in PCV13 are common in the PPSV23. And this is why in previous recommendations, the recommendations was to separate these vaccines by at least a year because they do share, have a lot of overlap in those antigens. So, who should get the vaccine? The CDC recommends pneumococcal vaccination for all children younger than 2 years old and all adults 65 years and older. And in certain situations, older children and older adults should also get pneumococcal vaccines before 65 years of age. Okay, so first I'm going to go through PCV13. This brand name vaccine is Prevnar 13. The CDC recommends PCV13 for, again, all children younger than 2 years old or people 2 years and older with certain medical conditions. And the new kind of recommendations are adults 65 years and older can discuss and decide, I have highlighted that there, with their doctor to get the PCV13. So studies show that getting at least one shot of PCV13 protects 8 and 10 babies from serious infections, 3 and 4 adults 65 years and older, and 9 and 20 adults younger than 65 years against pneumococcal pneumonia. So the new PCV13 recommendations, the old recommendations, I'll just go over that really quick. That is not listed on this slide, but it used to be that every adult 65 or older should get the PCV13 first, separated by a year, and then the PPSV23. And that was a 1 or 2 dose series depending on what you got your first dose. Now, ACIP recommends PCV13 for all adults 65 years or older who have not previously received PCV13, so when they were 2 years or younger. And then PCV13 should be given first, followed by PPSV23. So the kind of new recommendations are this whole shared clinical decision making. So the ACIP recommends PCV13 based on shared clinical decision making for adults 65 years or older who do not have an immunocompromising condition, and those are listed on the CDC. There's quite an extensive list. CSF leak or cochlear implants who have not previously received PCV. And all adults 65 years or older should receive a dose of the PPSV23. So some shared clinical decision making. Obviously, if the patient has immunocompromising condition, it is recommended for them to have the PCV13, but if they do not, the new guidelines recommendations are that they have that discussion with their provider and come up with what they think is the best option for them. So it's no longer recommended for adults older who do not have an immunocompromising condition. But that conversation can still be had, like I said, with providers, and patients can still choose whether or not they want to receive that vaccination. Okay, so the PPSV23 or Pneumovax 23 by the brand name, the CDC recommends PPSV23 for all adults 65 years or older, people 2 through 64 years old who have certain medical conditions, and adults 19 through 64 who smoke cigarettes. And that's definitely the big one. That's the most common reason that in my practice and community pharmacies, see adults get the Pneumovax 23 before 65 is for smoking cigarettes. So studies show that getting at least one shot of PPSV protects between 10 to 17 in 20 healthy adults against invasive pneumococcal disease. So the side effects between the two vaccines are relatively similar. The PCV13, there's a little bit different for adults and children. Obviously, pain, swelling, redness where the shot's given, fever, not feeling hungry, feeling tired, etc., headache. Children, redness or swelling where the shot was given, drowsiness, not wanting to eat, being fussy, mild fever. And the PPSV23, again, pain, redness where the shot was given, fever, muscle aches, and feeling tired or fatigued.